Okay? So the meniscus is part of the joint and the cartilage on the inside of the joint. And remember, you have the medial is a C shape and the lateral is an O shape. And it's inside of the joint capsule. The way that the meniscus is going to get injured is a combination of axial compression and rotation. So somebody's going to say, like, you know, soccer a lot of times will do that, or something where they're wearing cleats and they plant and they push off like that. So it's like grinding on the knee and twisting. It's kind of like in the low back. And we talked about disc injuries, herniations occurring when you're doing like this, lifting and twisting. So in the knee, it's a twisting type of motion. And then again, you know, if somebody, you can see if somebody's like this and they're twisting and then they get hit right there, everything's all loaded and torqued, so you can do your ACL, medial meniscus, MCL all together. And then, you know, this is the meniscus here, and you can see where you can have the tears in it. This is some arthroscopic view. And so you can have just simple tears in it, or you can have more complex tears. Like I said, you have the bucket handle tears. And you know, in the old years and years ago, what they do is go in and just pull the meniscus out. But now they try to maintain it or try to repair it. Or they'll shave pieces off or smooth it out with the arthroscopic. And then what happens is, let's say somebody has a knee injury where they've injured a few things. Maybe there's some joint laxity because they stretched and tore some of the ligament. Maybe they had a little bit of meniscus injury. And then you just add years of repetitive stress and strain on it, and you get degeneration. Then the meniscus wears and frays a little bit more. The ligament, because of the ligament laxity, there's more stress on the joint. You get DJD. So a lot of times people are having complications later on from an original acute injury, then they have things that develop over time. Right? Somebody says, oh, you know, I got this bad knee, I hurt it when I was playing football. And then, you know, years later, then they're going in and they're having surgery. Because it's gotten to the point where the cartilage is worn away, you know, the meniscus is all messed up. So meniscus, again, the thing with meniscus is that you're usually going to describe some type of a twisting mechanism. Okay? If I keep doing this, my knees are going to start hurting. It's usually some type of twisting, and then you may feel the knee will give way. And in this case, they're going to complain of something where they say their knee locks. Because if you have this loose flap of meniscus, you get it bent to a certain point, and then it just kind of locks, and then they sort of have to work it through, and then, okay, now it's loose. They'll get to a point where that little flap gets lodged or jammed in there, and the knee locks up, and they have to kind of move it to work it through. And so they could have popping and locking. So a lot of times, you know, the specific history questions when you're talking about knee is like, did you ever feel it give way? Does your knee ever lock up? Things like that. And then when you're palpating, you know, you can specifically palpate on the area at the actual joint line. You know, if you have meniscus, it's going to be a little bit narrower when you're actually palpating. So you'll be at this, like, you know, you palpate right here, like what we call the eyes of the knee. If you go just below the kneecap, there's kind of an indentation right there, and that's going to be the joint line. So that's where they're going to say, it hurts right here. So then range of motion can be limited because if you have that extra flap in there or if you have swelling. And then one of the tests that, I don't have a video of the McMurray test, but we'll go over that. But this basically, this bounce home test is where you're taking the knee like this and then bringing it into extension. And you're looking for it to not extend all the way, or when it comes like that, it sort of bounces back. Like that. And we'll practice that. But here, let me click a little.
So the bouncing back is like a protective mechanism by the rectus femoris or the hamstring muscles?
Not so much the muscle. It's because there's either fluid in there or there's a loose body in the joint that keeps it from extending. Like if this is a knee, it's not going all the way.
So it's an actual mechanical disruption.
Yeah. Yeah. More so that than a muscular thing. And then Osgood Schlater disease. As to this kind of goes in between contractile tissue and bony and inert tissue because it's almost like a tendonitis. It's basically where this patellar tendon inserts onto the tibial tuberosity. And a lot of times you see in adolescents, it's more so males than females, it's because they're growing at the same time and they're doing a lot of jumping, things like that. You know, as kids are playing basketball and whatnot, it's just pulling on that spot. So the bone's gonna bulge, you're gonna get a lump right there. And so then they'll have pain on contractile types of things like active resisted range of motion, jumping, things like that. But they also since it is affecting the bone, they could then have tenderness right on the bony prominence itself. So there'll be some swelling in there. So, you know, adolescent kids, you'll see that.
Sounds like a Norwegian rock and roll band from the 80s.
Could be. Yeah, I think they played with Boingo Boingo. So it's also, you know, it's a pathological bone process that occurs with because that's right where the physis, where the bone growth is occurring. So again, it occurs at an age where you're having bone growth going on, so it's affecting right on that spot there.
So what are some potential problems with it? Like besides just that, a little bit of deformity?
Yeah, not all that much.
So
It's just kind of a passing thing, you know, they'll have it, you know, they'll get a little bit swollen and inflamed and enlarged.
Do they sometimes tuck it down? Like the
No, I don't think of it as ever something that you would have surgery on it. You might say, you know, take them off the activity that they're doing to kind of rest it for a while to calm down the inflammation. So it's just repetitive jumping and running, and it just occurs at that age group where they're developing and there's changes in the bone that's going on. And so it's just something that would show up on an x-ray, but you almost don't need an x-ray. You know, if you see this big bulge right there, you can tell that it's there.
So would this happen with kids who are heavier? Would it be more likely to happen with kids who are heavier? Because I know there's lots of kids that are running and jumping and doing all types of crazy stuff.
The heavier kids, I think, are the ones that aren't doing the running and the jumping. That's part of the problem. So I almost expect that they wouldn't have the problem. But then again, if they were a little heavier and they started doing it, then there's more stress and strain to it. But I don't know if there's been really much correlation with the weight of the kid. But I would tend to say it happens more in the ones that are more active, which tend to be the thinner. Okay, now osteochondritis, that's the one that wasn't in the note. So on the back page of this thing that I handed out here, so basically what it is it's like a stress fracture to the bone. So it's on the bone just below the cartilage. So we're talking about subchondral bone. And so there may be some fragmentation or there may be a loose body in that area. And it's typically affects the medial condyle and more specifically the lateral part of it. So it's affecting it on this area here. Okay, so this is the medial condyle of the femur, but the lateral surface of it is where that happens. Okay, so there may be some joint swelling. Usually they can have full range of motion. And then there's the special test for that we'll talk about later, which is Wilson's test. So sometimes for that they'll go in and do surgery and clean up that area. So it's going to happen, it's a stress fracture, so it's happening from somebody repetitively, you know, stressing and straining, jumping and pounding on the knee. So they'll have pain with motion, some pain on range of motion, pain on weight-bearing range of motion.